An intra-arterial catheter is placed in a variety of clinical situations but is most frequently used for continuous blood pressure monitoring in patients undergoing high-risk surgical procedures causing concern for hemodynamic instability. It can also be placed for patients needing frequent blood gas measurements or in those requiring frequent labs without central venous access. Insertion of an arterial catheter into the radial artery requires sterile prep solution, such as chlorhexidine, sterile surgical towels, and 1% lidocaine. A 25-gauge needle and tuberculin syringe, a 20 or 22-gauge angiocath and a tegaderm, an arm board, gauze, alcohol, and tape. You will also need equipment to transduce the arterial blood pressure, including a transduction system and pressure bag. The Allen's test is a bedside exam that can be used to assess collateral ulnar blood flow when the radial artery is cannulated. Despite the popularity of this test, the predictive value of an Allen's test has been questioned. Ischemic complications have been reported after a normal Allen test. Also, radial artery cannulation has been performed without complications in patients whose Allen test was abnormal. See the text for further detail. To perform the Allen's test, occlude both the ulnar and radial artery supplying blood flow to the patient's hand. Ask the patient to make a fist for 30 seconds while continuing to hold pressure on both arteries. When the patient opens the hand, the palm and fingers should appear blanched. Release the pressure from the ulnar artery and watch the patient's hand. The normal pink color should return within 5 seconds, indicating that the ulnar artery provides sufficient collateral circulation to the hand. Gently dorsiflex the patient's wrist over the arm board. Use tape to secure the patient's hand and wrist in this position. In addition, some practitioners tape the thumb in an extended position to stabilize the radial artery. Palpate the patient's radial artery to locate the site of angiocath insertion. Cleanse the interior wrist with an alcohol wipe. Using a 25-gauge needle, create a skin wheel over the insertion site using 1 milliliter of 1% lidocaine. Cleanse the wrist with sterile prep solution. Put on sterile gloves. Drape sterile surgical towels over the forearm and hand, leaving only the wrist exposed. Palpate the radial artery again to confirm the catheter placement site. Direct the needle tip with bevel facing upward into the radial artery. Insert the angiocath at a 30 to 45 degree angle to the skin. Advance the catheter slowly into the tissue, watching at all times for a flash of blood. When the flash occurs, decrease the angle of the catheter. Holding the needle steady, gently push the catheter forward. If a flash was obtained, but the catheter is difficult to thread, advance the needle and catheter together approximately 1 to 2 millimeters. The needle may be located in the artery while the catheter remains external to the vessel. Inserting both together will push the catheter into the artery and facilitate threading the catheter over the needle. Occlude the proximal end of the catheter and remove the needle. Connect the hub of the arterial catheter to the pressure tubing of the transduction system. After connecting the arterial catheter to the transduction system, confirm placement by watching the monitor. Look for an arterial waveform with corresponding blood pressure measurement. A tegaderm should be placed over the hub and catheter entry site to keep the skin clean and dry. When placing a catheter in the hand, loop the tubing around the patient's thumb and secure the tubing to the patient's wrist and forearm. This decreases the amount of tension placed on the catheter and will help to prevent it from being dislodged. If the arterial line will be needed beyond surgery, consider suturing the line in place.